Brought to you by MuleSoft. With its API-led approach to connecting the world's apps, data, and Internet of Things, MuleSoft's Anypoint platform has helped enterprises around the globe revolutionize their businesses. What can MuleSoft do for you? To find out, visit mulesoft.com.
Hi, I'm David Berlind, Editor-in-Chief of ProgrammableWeb, and we're here today to bring you another one of our great videos. Today, my guest is Kelly Taylor. He's a product manager with the US Digital Service out of Washington, D.C. And today, Kelly is going to be talking to us about version 2.0 of the BlueButton initiative. Kelly, thanks for being on the show today.
Thanks, David. The US Digital Service is a group of technologists based here in Washington, D.C., designers, engineers, product managers that come to D.C. for a 3, 6, 12-month digital tour of duty. So I am assigned to Health and Human Services, where I've been helping the Center for Medicare and Medicaid with the BlueButton API. The BlueButton is a symbol for a patient's right to access their own healthcare data. It's something that began in 2010. And for the last 7 or 8 years or so, Medicare patients have been able to download a text file of all of their Medicare insurance claims. Mm-hmm. And this is a great step forward, for healthcare interoperability and so on. But imagine a patient prints out a 50-page, printout of a CSV file they downloaded of all the raw data. And so we started talking about how it's really the services, not just the raw data, that can ultimately benefit Medicare beneficiaries. So we came up with the idea of building an API for BlueButton that combines OAuth plus a FHIR-based API. The FHIR is a healthcare data format. And
it's spelled F-I-H-R, is that correct?
Yeah. And so those are the two pieces. So what I'm about to show you is BlueButton 2.0. We announced this a couple of weeks ago at the big healthcare IT conference in Vegas called HIMSS. Mm-hmm. And we now have a couple of hundred companies that are building with the BlueButton API and several companies that have gone live now with the integration. The important thing to remember here, especially with OAuth 2, is how what policy dictates us being able to offer this API, CMS being able to offer this API to third-party developers.
Mm-hmm. I'm sorry, CMS stands for?
Center for Medicare and Medicaid.
Okay.
And it's the office I'm sitting here in a block from Capitol Hill here in Washington.
Okay.
And there's healthcare law that many people are probably familiar with called Hipaa. Mm-hmm. And a lot of software developers have to deal with HIPAA regulations and a lot of constraints around developing in this type of environment. And there's a provision in HIPAA that talks about a patient right to their healthcare data and mm-hmm. how they're able to consent for someone to access that information. So that's what this is all based on. And that's the part that CMS really helped us figure out, whether or not we could build this API. And once we got the go-ahead to build it, that's where the US Digital Service paired up with our CMS colleagues on the policy side and built this.
Okay, I just want to stop you for 1 second because you mentioned Medicare a few times. So because when I think about this idea of being able to download your own health data, that seems like something that every person in the world would want, let alone just Americans. But is this just restricted to those people who are in the Medicare system?
It's a great question. And the answer is yes. The BlueButton API is for Medicare patients. There's about 57 million Americans on Medicare. Okay. And the BlueButton initiative that's been around since 2010, it's a symbol for access to patient healthcare data. So, for example, the VA, the Veterans Administration, has implemented their own version of BlueButton. Other large insurance companies have their own version of BlueButton. So it's just really this thing that patients will see throughout, and it's really it's one small piece of trying to solve the overall healthcare interoperability problem, which is still, of course, unsolved. Right. The FHIR data format is a big part of that, where it's a consistent data format that lots of people are using now. So there's a variety of initiatives. One's called Project Argonaut that focuses on using the FHIR data format for electronic healthcare record systems.
Mhm.
We're using a part of the FHIR spec that deals with insurance data, which I'll refer to a lot as claims.
Mhm.
Yeah, so that's what we're up to.
So FHIR when you talk about it being a format, it's sort of like a broad format. By what you just said, you're sort of implying it covers quite a few domains, covers healthcare data, covers insurance claims, things of that nature. And it's sort of a standard format, like standard field names, standard field sizes, all that sort of stuff. And then
Yep.
it's in some ways a standard that a lot of different systems providers and of course the BlueButton initiative is complying with in part or in whole. Is that what
You're exactly right.
Okay.
That is exactly it. It's now on version 3.
Okay.
With version 4 being worked on now. There's working groups for each area of the FHIR spec. You may have seen the announcement from Apple. The new Apple Health app now integrates with a variety of healthcare systems, for example, Johns Hopkins, and they are using STU2, which is the second version of FHIR that deals a lot, covers a lot of EHR. They call them resources in the FHIR spec.
Right. EHR, electronic health records. So this is the actual where the health information, the last doctor's visit, that kind of thing is being stored, right?
That's exactly right. And there's a concept in healthcare called a longitudinal patient record. And it is everything from when you go to the doctor and they take your blood pressure to test results you have to, the ultimate insurance claim that's filed. And if your insurer is Medicare, that's where it's filed and Medicare pays for it. And having that information all together into this longitudinal view is really what everyone in healthcare talks about as being the ultimate goal with interoperability. So when you go to the doctor, no matter where you are, no matter which specialist or doctor you're going to, that doctor has a complete, view of all of your information and can make the best decision for you. So again, this is one small piece of the puzzle. And with what we're doing, this idea of consumer-directed exchange of information or patient-directed exchange, the idea is one of the ways that interoperability in healthcare can be achieved is by putting the patient in control. When you look at health systems around the world, for example, in France, everyone has a card that they carry with them. And when they go to the doctor, it slots into the doctor's computer and it has all of their information. And then they take it with them, so the patient's in control. So it really touches on a lot of that here with what we're doing.
Okay, very good. So you have a demo you're going to show us, right? Or you're going to you've got something like Exhibit A?
Exhibit A. So let's take a look at the BlueButton website. For developers that are working with healthcare data, they can go to bluebutton.cms.gov to get started. This is a free API. At bluebutton.cms.gov, we talk a little bit about some of the things I just mentioned, why we're able to do the API, what it's all about. The API encompasses, like I mentioned, 57 million Americans are covered under Medicare. We have about 53 million Americans available in this API. There's a term Part A, B, and D data. This is a way to describe Medicare data, and it talks about hospital visits, primary care, doctor visits, durable medical equipment, prescription drugs. These are the types of claims and types of healthcare data that you'll find in this API. And we make up to 4 years of data available for each beneficiary. So let me just give you a quick glance at the documentation and then we'll get into the demo. So I mentioned earlier, this API is really 2 pieces. It's the authentication piece, which we're using OAuth 2. And it's the API piece, which we're using, I mentioned FHIR, and specifically for the healthcare geeks listening to this, we're using the explanation of benefits FHIR resource, which really helps describe a claim, an insurance claim.
Okay.
So just kind of scrolling through here just to give you a sense. So that's what the API is made of. So let me give you one glance at what an explanation of benefits claim, the type of data here, and then we'll hop over to the demo. So everything that we do is really based on code sets and encoding systems. So you can imagine a lot of kind of key value pairs of of which coding system it's coming from and what the value is. This is very common for healthcare data. An example of a coding system would be ICD-10, and you would see some value like 7, and you knew that 7 described, some type of condition. The API has a lot of cost information and a lot of, dates and times that you visited, which provider you visited. These are the types of things that developers need to combine with the other data they have, whether it's genetic data, whether it's electronic health record data, whether it's clinical trial data. These are the types of use cases where developers would take insurance claims and combine it with other things that they're doing to build something for the patient.
So there's sort of a standard vocabulary that they can access through the API as well to describe some of these activities, or?
That's right, and that's what the FHIR spec outlines.
Okay.
So in FHIR, they use terms like bundle, item, entry,
okay.
Extensions. So I'll just kind of scroll through. This is very healthcare specific, of course, as you can see. All right, so let me toggle over to one of the demos. So, this API, it is for a third-party application developer to build something that ultimately benefits the patient or the Medicare beneficiary. So at the
let's stop there for 1 second. What would incent a developer to build on this API? Is the developer working for a medical practice? Are they just trying to put an app out in the public domain that people would download and pay for? Like who do you envision being in the way of developers the first adopters of this?
It's a great question. A developer that'd be interested in this is a developer that has Medicare beneficiaries as their end users.
Mm-hmm.
So examples are a developer working on software for clinical trials, or a developer working on an EHR system,
right?
Or a developer working on an app similar to Apple Health, where like bringing all of your healthcare data, or a developer working on a home prescription drug delivery service, right? Things like that, where the more that the app or the service or the research project or the clinical trial knows about the patient or the user, the more interesting things they can do to ultimately help that user.
Okay.
And that can take the form of helping the user understand their information, like their insurance claims, or it can be much more sophisticated and incorporate this type of longitudinal patient data into prediction models and different machine learning techniques.
So businesses can benefit from the data as well as individual patients ultimately.
Yeah.
Of course, if a business was benefiting from that, like from a research perspective, there would be some requirements around it. I'm assuming like you would have to anonymize the data, or maybe that's a part of the OAuth implementation here, which basically says, okay, for this user, this is available, and for this other type of user, only this other information is available.
Yeah, a good example of something that wouldn't directly benefit the patient might be a research study, where the patient is choosing to, OAuth with the third party and consent for that third party to use their data, and to share that data with the third party to help them with their research project. So, you can imagine 1,000 patients donate their data to a project like Sync for Science or Google's Project Baseline. These are a variety of companies that are leveraging BlueButton today. And that would be incorporated into the models that these companies are building, trying to better understand people's health and how to make everyone healthier.
Good objective. Okay. I interrupted the demo, so let's go on.
Yeah, so like I said, we launched at HIMSS a couple of weeks ago, and there are a variety of companies that had participated in developer preview that we've been running for several months. The company I'm showing you here is an example of a health data aggregator, and health systems, like the sample health system that you'll see here, that doesn't have their own software development team, would use a product like Human API to help coordinate this claims data coming into their system so they can benefit. You see that a lot in healthcare, where providers and other companies in the healthcare ecosystem, they just don't have the engineers on staff, right? They're
Of course. Yeah.
So there's a lot of middlemen, software vendors here. So what I want to show you is really the authentication flow. So this is an example of a beneficiary being in front of Starfleet Health. Oftentimes, this is referred to as a patient portal. You may have experienced this if you've checked into an appointment or scheduled an appointment online with your physician. And what you're seeing here is the patient has clicked to connect their Medicare account with this patient portal. So this is the first view of the OAuth 2 flow. The identity that we're using to support the OAuth 2 flow is mymedicare.gov, which is a portal that all Medicare beneficiaries have access to and have an account with. So that's where we're holding that's the identity source that we're leveraging here. And so you're seeing a sample username and password being entered here. And then once that they're authenticated, they see the consent view, this approve access view. And this is telling them, that this third party is going to have access to this type of information. And so this gives them a chance to really understand what's happening and go ahead and approve access.
This is the sort of thing that people click on with never even looking at it, right? It's, in many ways, this is in the news right now with what happened recently with Facebook. Like, the app said what it was going to take and people clicked on it anyway. People blow through these things.
Yep, exactly. So that's something that we're very cognizant about. With each third party that we work with, one of the things that we've been very serious about here is our access to production data. So each company goes through a vetting process that we have. And
so that's important. That's important. In other words, there's before a developer gets access to the API, they have to go through a vetting process, and you have to approve them.
Yeah.
Okay.
And, that's exactly right. And one of the things that happens here too is the beneficiary has looked at the terms of service and the privacy policy of whatever applications they're using. Now, of course, we're very concerned that oftentimes those privacy policies in terms of conditions, in terms of service, aren't read. We know that. So we're doing as much as we can here to educate beneficiaries to make sure that everyone is a good actor in our system. And of course...
And theoretically, they're going to, a Medicare patient who visits multiple doctors, multiple, hospitals, whatever, they're going to see this like 5, 6, maybe 10 times, right? So they'll sort of get accustomed to the workflow because the chances that a Medicare patient's just seeing one specialist is very low.
Yeah, it's very interesting putting the patient in the middle of their healthcare, right? Yeah. They'll have this experience in other things that they do as well. For example, when they log into their patient portal, some patient portals allow them to share their data with other providers. It's very interesting to see, at CMS, we talk here a lot about the changing demographics of the Medicare population. So someone that's turning 65 today could have had an iPhone for the last 11 years, right? Seniors are becoming very digital. They're using apps now to like Fitbit or 23andMe and a variety of different technologies that, it's different now than it was a decade ago.
For sure, yeah.
So this is a good, a small step forward to try and help them.
Okay.
So continuing on the demo, they've now synced their data. And the next thing you'll see is some of their data flowing into this patient portal. And, again, I'm going to stop it here. This is an example app, a prototype. So if you look closely at the data, it's all of our test data. One of the things that we offer developers is we have a sandbox of 30,000 synthetic patients, which is a term often in healthcare software development, where it mimics a real patient, but you can't re-identify it, and things like that. So you see here some of that data. And a typical use case is the third-party app that's consuming the BlueButton API will draw some sort of timeline. Like I mentioned, a longitudinal patient view. And a timeline view is a common view for longitudinal patient data. So the physician can look down the timeline and see, which medications the beneficiary has been prescribed, see other information that's coming from the electronic health record, and, understand cost of things over time, different procedures that the patient, the beneficiary may have had at other providers outside of this EHR, which is really key for interoperability, and then make better decisions about their care. So that gives you an example of how a patient or Medicare beneficiary would OAuth to grant consent, and then how the developer would then take that token and query the API to retrieve their claims data.
That's a really interesting point that you're making, particularly about the availability of certain data to a variety of stakeholders. So like if I break my leg, which involves a visit to my primary care, the hospital, the orthopedic surgeon, the therapist. If somebody said, "Well, how much did it cost you to break your leg?" I wouldn't know the answer to that question, right? But I'm gathering from this kind of functionality, you could figure out what the total is. You can figure out what the total bill was, and you can also figure out how much of it was covered by insurance. I mean, there's a whole bunch of data here that suddenly becomes available, queryable, if you want to call it that, and that could lead to other improvements and positive outcomes in the overall healthcare system.
You're exactly right. And that's typically referred to as the explanation of benefits, the benefits you're receiving from your insurance provider. And that's also the name of the FHIR resource that we are using to model this data. And scroll down and give you an example of what the API specifically looks like. I mentioned before, entry and items, but this gives you a sense here of the type of data that you find within that Medicare claim. Who the care team was, how much did it cost, what the diagnosis was, when did it happen, and where, things like that. And you can imagine, putting the patient in the center of their healthcare. If they have that data with them and they're able to share it with the different specialists and the provider, that's one way to achieve interoperability.
Right. In terms of looking further out into the future, do you envision that in order for certain healthcare providers to be able to work with Medicare, or for certain doctors, and I guess just the doctors, maybe the insurance companies, I don't know, but will you require this? In other words, will this sort of be, okay, either A, you're using the BlueButton API, or I'm sorry, you don't get to come to the party? How does that work moving forward? Because my understanding is the Department of Health and Human Services, I testified to the Department of Health and Human Services about API security about a year ago. And my understanding was they were trying desperately not to create a standard API that everybody had to comply with. Right.
The more you write technical rules into regulation and policy, the more you risk, boxing yourself into certain technologies.
Right.
The ONC, Office of National Coordinator.
That's right. That's who I testified to. Yeah.
Yeah. So, that organization is right across the street from us. We spend a lot of time together. They work a lot with healthcare IT vendors. They talk a lot about open APIs and all of this stuff that's driving healthcare interoperability forward from an industry perspective. One of the things that we do, I mentioned earlier, this is just for the Center for Medicare and Medicaid, and just for our patient population. But we do open source everything that, and of course, all government agencies do that. They open source the technology they build. So, other payers, Medicare Advantage plans, and others can take what we've done and, build their own versions of BlueButton. And, like I mentioned, the VA and Department of Defense has a BlueButton, and other payers have done this. So, the more that we push the boundary with CMS in terms of providing better care for beneficiaries through putting them in the middle of their patient care, and hopefully others do the same.
So just going back to the API, I imagine that it's kind of works both directions. You can, depending on the application, you can query it, but you can also post updates to it.
So this API is read-only.
Read-only.
The
Okay.
claims information, it all flows into the system from the providers. So they're the ones that submit claims to Medicare. So the doctor submits the claim. And we don't have a way to say like, hey, I found a mistake in this claim, update it. Yes.
Okay. Oh, yeah. So that's maybe coming ability to update certain records.
It's a type of thing that developers ask us about a lot. So it's been wonderful. We have a couple, like I mentioned, we have a couple hundred companies, big and small, healthcare, fitness, lifestyle, all sorts of industries that have been using the BlueButton to prototype, and it's been awesome getting their feedback and the ideas.
Are you going to extend BlueButton to cover more of the FHIR domains than just the claims data?
For CMS, their world is claims data, but we will continue to add as much of the claims data as we can to the API, to the explanation of benefit FHIR resource that we're exposing. But with others, for example, EHR companies, they'll use other parts of the FHIR spec. I mentioned Project, I'm forgetting the name now.
Project Baseline.
The FHIR spec. Project Argonaut is the project that encompasses FHIR resources for EHR companies.
Because I can imagine that some of that part of the spec would have to involve APIs that you can write to. Like for example, I have the smartwatch, and it's got my heart rate and all kind, and I can imagine wanting to contribute some of that data into my health record, right?
Right.
Yeah.
Right. And oftentimes people refer to that as exogenous data. There's all sorts of interesting things happening with how this type of data can be used at the point of care. People talk a lot about how a physician just sees, when they take your blood pressure or your heart rate, it's just that point in time for seeing a trend that you could hand to them with your smartwatch over time.
Right.
What's fascinating about claims data is how large it is. So for each beneficiary, they could have hundreds or thousands of claims that come back.
Right.
From the last 4 years and beyond. So it's
all the incidents, the medications. I mean, it all goes through.
It's a very rich data set. Yeah, absolutely.
Okay, so for developers that are watching this video and would have an interest in learning more, where can they go?
So bluebutton.cms.gov.
Okay.
And I'm not sure when this comes on, but if you're in town next week, we'll be at Health Data Palooza.
Okay, so next week is the last week of April 2018. We'll be probably getting this up just in the middle of that, unfortunately. But I'm guessing you have one of those every year. So if you miss the 2018 one, you can always come back and for future editions of that event, right?
Absolutely. And on bluebutton.cms.gov is our developer documentation, ways you can try the API, and a Google group that we're very active in. So you'll find engineers with rich experience in claims data and APIs answering your questions there as you get going.
And for other API providers that are looking at what you've done here and saying it's pretty clever, and they want to know how you built it, what systems are in your stack? What'd you build it on?
Sure. So we have a Django front end, and a lot of CMS is leveraging AWS.
Okay.
Cloud computing in government is still a cutting edge innovation.
Of course. Yeah.
So, one of the funny things that our team talks about all the time is if we're doing anything new here, we're making a mistake. So every single thing that we did is very just standard, unremarkable. And the true breakthrough here is not necessarily the tech stack, but it's the, understanding how to have this consumer directed exchange to give people access to their data.
Okay, well, Kelly Taylor, a product manager with the U.S. Digital Service. Thanks very much for joining me today to put this video out. Appreciate it.
Thanks, David.
Yeah, we've been speaking with Kelly Taylor. He's the product manager of the U.S. Digital Service out of Washington, D.C. Thanks very much for joining us. If you have comments or questions, be sure to throw them underneath the video or on the article that it's embedded on ProgrammableWeb.com. I'm David Berlin, the editor-in-chief of ProgrammableWeb. Thanks for joining us.